Must be wondering why you're seeing all the white jackets. Billy, get them all, get them all. These beautiful doctors are here. There they are, all right? And I can see Ahmed there, not wearing a white jacket because special day for you. Hi.
Hi.
Good morning.
Good morning.
Fantastic. I'll be speaking to you in a few minutes. Why do we have individuals wearing white jackets in our audience? It's because it's a very, very special month for the University of Nairobi. The School of Medicine this month, specifically on the 28th of July, will be marking 50 years. Can we just give a hand for that? Is that a big deal or what? It is a big deal, yes. And as you always know, every single Thursday we connect with the university here where we film this great show and we seek to really take a look at some of the positive milestones undertaken here, and I'm really excited about marking this anniversary. This morning I'm joined by three gentlemen who can tell you it has not been an easy journey, but it's been a beautiful one. Good morning.
Good morning.
How are you gentlemen doing? It's good to have you here. I'm going to start at the very top over there. Hello, sir.
Yes.
How
Hello,
are you?
Thank you.
Tell me a little bit about who you are and also about the School of Medicine.
My name is Peter Odhiambo, Professor of Thoracic and Cardiovascular Surgery, University of Nairobi Medical School. I have been there since 1976, and I hope I'm still strong enough to continue, and here I am.
Absolutely, great. Yes, you are strong enough to continue. For you, sir, looking at, of course, the school in itself and your role in it, tell us a little bit about that before we get into the 50th anniversary.
Thank you very much. My name is Johnson Ireri Kinyua. I'm currently the Director, University Advancement in the Office of the Vice Chancellor. Initially, I was the Executive Director, the Alumni Association. And my work basically is to support the faculties, the schools, and the colleges to advance in their various issues. And one of the things that I want to support very strongly is the marking the 50th anniversary, which is a very big milestone for the school.
It is a huge milestone.
Since 1967.
Absolutely wonderful.
To this day.
Yeah. And so you are the current dean. Tell me a little bit about yourself.
My name is Professor Fred Namenya. Since my senior colleague put three names, I shall do the same. I'm Professor of Pediatrics in a field called newborn medicine, where we look after the littlest of the babies. But more importantly, currently I'm the Dean of the School of Medicine, the lead in terms of all those programs, and my wonderful young people here, my current children and students.
Yes, they are here indeed.
Yep.
Absolutely, led by Ahmed, who's sitting at the front. Hi, good morning.
Good morning.
Okay, hold the microphone close so we can hear you. Tell me a little bit about yourself, Ahmed, and why you decided to get into the School of Medicine.
My name is Ahmed Deko. I happen to be the chairman, Association of Medical Students, University of Nairobi. I joined medicine 5 years ago, 2012 September, and I was fascinated at the very beginning, so am I right now. And I'm also joined here today by my very colleagues who have come here to mark this important step in the School of Medicine.
Absolutely. We seek to create awareness on this great day, and we seek to join you in the celebrations. We're very excited about this particular day. But looking back, Professor, where you started, 50 years is a long journey. Take us back a little bit in history. Where did you begin?
As a matter of fact, thank you very much. As a matter of fact, I'll take you back a little more than 50 years.
Okay.
Let's start from independence, 1963, and come on to 1964 with our republic status. At that time, our founding fathers and everybody in this country were out for development. I think the clarion call was, we want to fight poverty, disease, and hunger. Very soon, they actually evolved a system in collaboration with the international bodies like World Health Organization, that we needed a medical school to train our people, to treat our people. And from there on, everything rolled by itself. As of 1964 made onwards, there was constituted a World Health Organization assistance group, and then a medical school planning group. 3 years on, they worked many meetings. I think the total number might have been about 15. Come March 1967, it was now decided that we are starting a medical school. And this medical school would anchor the bit that of the three evils to fight disease. And yet again, also to help the region anyway.
Right.
That's how the medical school ultimately evolved, and on 3rd of July 1967, the doors opened for the first 30 students. 4 didn't report, 4 reported, 26 reported. And by the time they finished in 1972, we had 15 doctors.
Wow.
Made and groomed in Kenya. As of 1985, or thereabouts, the Faculty of Medicine, as it was called then, now we're talking more of the School of Medicine, the faculty actually was blessed by another promotion of being upgraded to a college level. The collegiate system on the University of Nairobi literally started around that time. Now we had a faculty and a college. It was one faculty, one college, which went on until 1995.
Right.
When we weaned off pharmacy into an independent school, dentistry into an independent school, called School of Dental Sciences, and here School of Pharmacy. Nursing came a few years later as a School of Nursing Sciences.
Okay. Amazing.
A lot has happened. And to a point where everybody comes to Kenya, actually, we've had a lot of student exchanges with many international institutions around the world. North, west, and east.
Okay, amazing.
Yes.
Now, looking at, of course, the milestones and the achievements over the years, over the last 5 decades, really, 15 doctors to start with, and now even my own personal doctor went to school here. A lot of doctors operating in this country started from here. The pride that this must fill the faculty with, and the rest of the country. Talk to us about this, Johnson.
Well, 50 years, some of us were not yet born.
Yeah.
We were born maybe
Are you sure?
And well, when I sit with Professor Odhiambo and Professor Were, it feels so proud to be associated with the School of Medicine. And what we are great this year is that as part of the gift to celebrate the 50th anniversaries, the Office of the Vice Chancellor and everybody decided that we'll put up a 600-bed teaching and research hospital.
Wow.
For the University of Nairobi. As you all know that we have been using Kenyatta National Hospital, which is an independent parastatal, but it's high time as we mark 50 years that we better have our 600-bed
wow.
teaching hospitals, and that's the project we want to deliver as part of marking the 50th anniversary.
All right.
Yeah.
Professor, we're looking at this great feat and looking at how far we've come. The impact of this launch, the impact of this new hospital by the university. Talk to us about this, not just within the institution, but to the country.
Teaching institute of our caliber requires to pride itself in a hospital by its name. I'll begin there. That sounds political, but that's precisely what it is.
Okay.
And what we aim to do in that hospital is to provide the teaching for our students of a different level, the highest possible. That's objective number 1. Number 2 is provide health to Kenyans at a lot more affordable price than the usual private institutions, at levels equal to, or in fact higher than what those institutions are doing today. So our students will not only be learning how to practice top-end medicine, our Kenyans will also be enjoying the same, being treated in the most academic and best equipped institution that there will be. Beyond that, we expect that we pick up a bit of what we call medical tourism. We have lots of Kenyans, for instance. There are figures about the number of Kenyans that go to India, go to South Africa, all the sort of places for illnesses that we think we can't handle here. We want to put that as a thing of the past. And really at the end, again, we shall continue being in Kenyatta a bit. So our students will learn our public health system as we know it. Our students will learn the other level of practice, so that when we release them to Massachusetts or the other places that we as a world-class university want to be producers of, they have seen it all.
Amazing, amazing. Guys, you guys are great, and we're so grateful that you've decided to take up this. I think it's a calling to decide to be a doctor. Ahmed, for you, knowing where the country has come from and the kind of challenges we face on a national scale when it comes to health, affordability, access, infrastructure, deciding to still go into it, what motivated you and how has it been going through the motions?
I think that's quite a tough question.
Yeah.
From the very beginning.
And your profs are sitting here listening to you.
Very, very much. I think from the very beginning, when I joined medicine here, my dream of becoming a doctor, somebody who has got such a huge impact in transforming the lives of Kenyans and trying to give quality care, has never changed. And I am really fascinated to have had medical school training under one of the best universities in the country and probably the best in the world. We are also privileged to have one of the national referral centers we have here in Nairobi. Kenyatta National Hospital is not just a teaching hospital, it's a referral hospital. So during your training, the best thing that you need as a medical student is to have such a large scope of diseases where you can see by the time you're leaving out of medical school, you have everything. And having such kind of a rare opportunity has basically nurtured my interest and my passion and my enthusiasm of becoming a doctor. Within the universities, and before we graduate, we normally have these medical camps. Every time you see that you have a patient who has come to you, and then the little knowledge that you have to have helped him, given him a drug, whatever relief and the prayers and how the person is so much happy, that actually gives me the urge to finish and become a better doctor.
Absolutely. Well said, Ahmed. Well said. Professor, looking at, of course, the country and where we've come from, and these are issues that have plagued us nationally when it comes to access, when it comes to affordability, and countrywide, even in areas where really you have to travel long distances in order just to access healthcare. Looking at doctor strikes and remuneration, issues that we've even dealt with this year. There's been a lot. What would you say about, I guess, the fraternity and the faculty having to deal with some of these issues that are on a national scale?
Well, talk of an environment, talk of professionals, talk of needs and services. Somewhere, somehow, there should be a balance for effective outcome. Some are constraints that people might not help, countries might not help, but the aspiration should be such that the environment is enabling. And our professionals have worked under very, very strenuous conditions. Mm-hmm. This is a developing country. Take any other developing countries where technology is at a certain level. In order to get your professionals break through these kind of constraints, there must be an enabling environment inbuilt and actually nurtured locally. And that's where sometimes somebody comes with the inspiration that I'm hearing my own student Hassan putting across, yes, with the enthusiasm and waiting for a job satisfaction at the end when a patient is healed and going home. And he cannot do that. At the same time, he's actually rubbing shoulders with his peers who went the other direction. Not wrong, but not another direction.
Right.
And they are making it, and he cannot make it. Somewhere, somehow, the frustration mixes such that you have the things that we've had, right, in this country. And so somewhere, somehow, there should be a balanced view of needs and what one can do.
Absolutely.
Yeah.
Looking at, of course, the young people who, these guys are there and we're happy that they're there, but those who are aspiring to join medicine, those who are aspiring to get into the University of Nairobi, yeah, who might say, you know what, Kenya is not ready, how long will it take me? There's so many issues within the health sector. Johnson, what would you say to them?
Well, these are my good brother, young brothers, yeah, and as you said earlier, medicine is a calling. Yeah. You ascribe to it the way a pastor is called into preaching. You are called to heal and to subscribe. I think when you do it from your heart and from that calling. The frustration you see in the medical fraternity will not forthcome. I was reading a book by Steve Jobs. He said, if you have a vision, you don't need someone to push you. The vision itself will pull you.
True.
So that is the calling that I would like my young brothers to subscribe to. That is about saving lives. It's not about money. And as my good Bible says, seek ye first the calling, and the rest will be added. The money, the dignity, the decorum will be added unto you, right, as you seek the mission to save lives.
Absolutely.
So that would be my message to my young brothers who are already pursuing the medicine at the University of Nairobi. And not only the doctors, even the lawyers, the agriculturists, and everybody else.
Absolutely.
When you seek that calling, the rest will be added automatically without fighting or demonstrating in the street.
Professor Were, come in on this, where, of course, we are not where we'd like to be on a national scale, not just within the institution. What measures, not just government, but also private sector, partnerships, sponsorships can we take in order to improve healthcare across the board for Kenyans? And so with that, of course, the ripple effect will then get into the learning institutions. Talk to me a little bit about this.
Well, let me begin with the measures that I'm responsible for.
Yes.
The one main one is to make sure that we have a doctor for every 1,000 population, or maximum. I haven't go there yet. But universities have to open up and resource themselves to be able to satisfy the needs of this country. If you look at the strategic plan of the Ministry of Health, it says at present that in every what we call sub-county hospital, we should have a pediatrician, we should have a surgeon. That's not county, the smaller hospitals. At every health center, the one next to, well, you didn't grow up in the village, I don't think. The one next to most villages, you're supposed to have 1 or 2 doctors. So at the current rate of that drive, it will take me another 100 and something years to fulfill that need, but we won't wait that long. The point is that everybody has a role. Our role in the University of Nairobi, we keep calling it the medical school. I'll correct you there because there are 5, 6 medical schools, but there's one school of medicine.
One school of medicine.
And that's this one
that's
in the country.
Yes.
So keep that in mind as you mix the two terminologies.
Yeah. Don't get it twisted.
Don't get it wrong.
Yeah.
The school of medicine is one in the country, and it's this one.
Okay.
Yes. It has a responsibility not only of populating Kenya with the well-trained doctors and the dentists and the others, but it has the responsibility actually of even building the capacity of the other schools. They'll remain being called medical school, but as the big father, the mother, we actually work very hard on trying to train for them as well. So the really correctable issue that falls in my lap is develop suitable human resources for health in this country. Alongside that, I shall participate in the agitation for better resources, better services, or better salaries, like Mwalimu of mine there said. Yes. But more importantly, to be able to be listened to when we advise about what do we need to have in a county hospital for it to function as well as we want it to. What do we need to focus to improve the outcomes of mothers who are delivering and all that. So, and I think that is, we participate in that in the rich research activities that we do. We provide the ammunition with which a Ministry of Health can produce policy and guidelines and those sort of things. So we have a role, and the big one. We are battling with it. It's not finished. It's not easy. It's not supposed to be easy. It's not supposed to be finished. It's like a friend of mine who works for a group called Pathfinder made a joke one day. Did you find the path? I said, no. If I find it, I'll be out of a job. So this tough thing of ours, though we haven't found the end of it, but we must remain at the edge ahead of disease and suffering.
Yes.
My input, human resources, well-trained, well-mentored, well-prepared, well-charged. I might continue too long.
Continue.
Yes.
No. Give it up for these 3 gentlemen, everybody. Give it up for these 3 great gentlemen. When we come back in just a few minutes, we talk, of course, how the university will be marking this 50-year anniversary. And I speak to Ahmed and his fellow students a little bit more about what it really takes before you even graduate. I think it's the longest course in the world, isn't it? Medicine, right? It is the longest. How many years?
6.
6. It's too long.
First degree.
One more.
One degree.
1 degree.
And then you have to do residency.
Specialization.
Ahmed, you'll tell me all about that in a second, right, guys? And I want to talk to you guys about how wonderful it is to be marking 50 years. You're part of this great historic day. For now, we take a quick commercial break. We'll be right back after this, everybody. Give it up for them, please. I wish you guys could sneak in and see us on commercial break. You think doctors are such serious people. They are not. The dean here is quite a hilarious man. Right, as of course we've told you, the University of Nairobi is marking 50 years, specifically the School of Medicine, and it is a big deal. There's a hospital coming out of this great day, and I want to know how you guys are marking this amazing, amazing anniversary. Let's start with you, Dean. Do they know how funny you are, first of all?
Oh, they have an idea.
All right, tell me.
Fairly quickly, I'm going to set aside 3 days, actually, 26th, 27th, and 28th. And who do I want to know that I'm 50?
Yeah.
I want the public to know. I'll inform the public by allowing them to come and enjoy 2 days of a health camp, in which I shall treat all ailments that are treatable easily and refer those that can't be treated. We'll be at Kenyatta Hospital, so the best will be available. At the same time, between that, during those days, I'll invite a few students from some schools nearby, young students in their third, fourth form. So they come and start finding out how wonderful it is, even if difficult, to be a doctor. They come and listen to our conversations there. They mixed with the hosting students, who will be this group that are supposed to be very busy throughout those days. Yeah. So those 2 days are actually belonging to the public and the students. These ones plus those that are coming from high schools. Okay. These ones don't get off the hook yet. Yeah. On the final day, the 28th, it's again their day to now host the bigger occasion of the actual launch and the celebrations, which will have again the public. It will have the alumni, and I didn't tell you how many alumni I have from all over the world. I'll keep that for another day. Oh. If you go to World Health Organization, to UNICEF, to World Bank even, you won't miss an alumni of the School of Medicine. Amazing. Of the University of Nairobi. And of course, Parliament. Yes. And among the governors, I have 1 or 2. Yeah. So we have been that productive in terms of diversifying. So then that day will be belonging to, again, the students, but the public, but now the alumni and other dignitaries to come and give some conversations to the public, to those who come there. To the young students, these ones, they need to know what you become when you complete as a doctor. Right. And particularly the young ones who will come from Kenya High or whatever that will come, they need to know, not to be discouraged by the 6 years. Yes. To know the juicy parts of medicine.
There are juicy parts. Healing being the juiciest.
Plenty. That's seeing people recovered from the jaws of death. Yeah. That's wonderful. It's amazing. I think that's about it, but there will be plenty more that I will say on the day itself.
Okay. Before we talked about mobilization, Professor, Professor Oluwa, tell me a little bit about why this day is so important for the university and participation and getting Kenyans to come and participate even though you don't go to the university.
Many times, more recently maybe, but some terminologies keep coming which mesmerize people. Monitoring and evaluation. Yeah. And when somebody says M&E, it sounds very educated and very knowledgeable. Actually, this is happening all the time.
Oh, yes.
In the sense that when you have a certain history of yourself, you need to know where you came from. And you need to mark where you are and dream for the future. Now, dreaming for the future has one part that does not quite come all the time. You need to be accountable, not for now, not for the past, but for the future. You leave a legacy. If an institution develops to some greatness, it is this legacy which came from day one, through all those years, just as well to stop some time and remember, mark it, and shoot.
Absolutely. It's vital.
So 50 years is one of them. We did actually do 25 years. The Silver Jubilee in 1992 actually did. The Faculty of Medicine did as a landmark. Because you cannot celebrate every day. Yeah. Somewhere, somehow, history, I don't know what it is, which made us keep on marking a decade, then a Silver Jubilee, then a Golden Jubilee. It is important for an institution to take stock of itself. The School of Medicine has done wonders around, let me put it that way, because we might see people going to other countries in the medical tourism sense, but in-house, we actually diversify that we have literally every specialty in medicine in this medical school, housed within, of course, the campus of the Kenyatta National Hospital. We have neurosurgeons, we have pediatricians like my dean here, and that's no small matter. Then under pediatrics, you'll have neonatologists and others, and then ultimately you finish with that. You come to surgery, you'll have many others. Medicine itself, internal medicine. So we have neurosurgeons, we have cardiac surgeons, open heart surgery, we have urologists where kidney transplantation comes in, and the first kidney transplantation in Kenya was done in 1978. Much as now we have people going abroad. Why? Because of that enabling environment I cried about a little while ago. Heart surgery from 1973, first one. Then we built on, specifically as a program, 1975. I know that for sure because I am a heart surgeon.
Yes, exactly.
Okay? Therefore, I can tell you the rest of that story. In orthopedics, wow, we have all manner of surgical antiques and surgical feats. So these specializations are here and must be marked. We must stop for a moment and mark them. 50 years, yes. And I think we can't pass this. 50 years will not come twice.
Yes, absolutely. Johnson, for you, public participation, mobilization is so important.
Yes, Kobi, and as the Dean rightly said, we only have one, the medical school. 80% of the doctors, or 90, have graduated from the medical school of the University of Nairobi.
Yes.
And we want all the doctors, starting from our cabinet secretary in charge of health, Dr. Mairo, to be one of the persons whom we want to invite.
My classmate.
Classmate of the dean, and he is the immediate chair of the medicine chapter of the alumni associations, plus other doctors spread across the national and county government, the hospital, public, private, all of them to come in big way and participate in this gracious occasion. We'll have dinners, we'll have outreach, we'll have clinics, we have everything. And we'll be reaching out to them through a card, special invites, email, advert in the paper.
We'll do one better for you.
Yes.
We are going to put this event on our social media platforms,
True.
NTV Kenya and Better Living,
Yeah.
where we'll give national awareness on this great day and the fact that it needs to be marked on a national scale. Remember, the University of Nairobi is marking a huge, huge anniversary and they want you guys to participate. How do you do that? Well, you have to log on to our social media platforms to find out how, but we'll be giving you more information as the days go on. Ahmed, why is this so important to you? Although 50 years ago you definitely weren't around, but why is this so important to you and the rest of the students?
Well, I think what we need to understand here as medical students, we have had this celebration today, and we are very fortunate to be the people who are actually celebrating with the rest of the country. Having not lived that time, we have this feeling of what medicine and being a medical doctor and being within the vicinity of Kenyatta National Hospital and having the feeling of trying to interact with the patient, especially when things actually look so desperate and people have got the feeling that nothing is going to happen, and with the basically with the intervention of God and with the help of a medical doctor. Especially, I have my dean here, very proud of him, to be a pediatrician and basically a neonatologist. We have Professor Odhiambo here, who is a cardiothoracic surgeon. Having this kind of people around you and the feeling that the patient have had every single time that somebody makes an intervention and somebody tries to help them, this is what motivates me right now as a medical student. But from the very beginning, I may not have had the exact picture of what a doctor is, a medical student is, despite all the challenges that we have through the training, what the future looks like, and the inspiration that we always get from our teachers and our lecturers. And the very beginning, when every time you try to help a patient, that is what drives me, that's what motivates me.
Amazing. You have one guy that you wanted to tell me about when we took the break, and he's sitting right here at the very front, all right? Why is this guy special? Everybody is special, by the way. Even you non-doctors, special, all right? But for you, why did this guy stand out,
I think
Ahmed?
That guy is called Riako, and he is a classmate. We've been classmates ever since the beginning. We've been classmates for 5 years, and having known him for all these 5 years, I think he must be having something special to share with the rest of the world.
Yeah, hi.
Hi.
How are you?
I'm okay.
What's your name?
My name is Evans Riako.
Evans Riako. Evans, why did you decide to become a doctor?
For me, it's just passion. I think back when I was in Form 2, I came across a story by Ben Carson. The book is called Gifted Hands.
Beautiful book.
And then for me, it demonstrates, it's a story from which I see that somebody can actually overcome the obstacles. Yeah, so it's a story I really identify with, seeing where I've come from. And I think in this 50-year celebration, I think it's a time to reflect.
Yeah, absolutely.
Yeah, it's a time to reflect on the achievements that we've made as a School of Medicine and look into the future. And I think the future can only be bright.
Very true.
Yeah.
You know, we've heard from many male doctors, students. I think a lady, I love when women get into different fields. Hi,
Hi.
How are you?
I'm fine, thank you.
Tell me your name.
My name is Brenda.
Brenda,
Biwott.
Daktari.
Yes.
I call you all Daktaris. Brenda, why did you get into medicine?
Growing up, I was quite a sickly child. So I used to tell my mom, so mom, if I'm going to be in the hospital for so long, I might as well work there. But that's on a lighter note. So we'd go to hospital and there's so much suffering. But then, if I go home, they're like, umeona daktari, uko sawa. So I thought, to impact the common wananchi in such a small way. But even if they're not feeling well, they have been seen by a doctor, they're fine. So in our small way, I feel like doctors do make a difference. We get to work because you only have a sick off if the doctor says you do,
Yes, exactly.
So I thought I might as well change the world. And how so now if you're celebrating 50 years, what if they had not started? So this is so great,
Yeah, very well said, both of you guys, very, very well said. And today we just want to honor you guys and say thank you for being here. Thank you for deciding to take the call, all right, and get into healing, which is not an easy call, but we appreciate you, we honor you, and we can't wait to celebrate this and mark the 50th anniversary on the day. Ahmed, thank you for coming with all your friends.
Thank you so much.
Asante, it is our pleasure. Director Johnson, asante sana for being here this morning. We really appreciate you guys. We can't wait to see. Are we invited?
Yes,
And
yes.
we will be there.
Yes.
Us guys will be happy to
Live.
Yes.
Make it live.
Thank you. You know what I really love are the camps.
Yeah.
Especially the medical camps.
Yes.
Absolutely. So listen, if you want to be a part of this wonderful, wonderful day marking 50 years, all you have to do is log on to our social media platforms to find out how you can do that. NTV will be supporting this great initiative, so make sure that you also participate. The University of Nairobi is doing big things, all right? For now